Baptist Health is improving the health of Arkansans by changing the way healthcare is delivered. One way is reaching far beyond the hospital setting through our community outreach programs, where more than 16,000 patient encounters are happening yearly to help patients keep on amazing. Baptist Health Community Outreach offers 31 different programs. One of those is Heaven's Loft in North Little Rock, where prenatal and parent education is offered, as well as needed baby items. The education that Rachel Davis received at Heaven's Loft proved to be life-saving for her baby.
I actually had decreased fetal movement. He was a week past due. He stopped moving as much, and I knew from the videos that we watch and the instructions that we listen to that it's never a good thing that your baby's not moving. And I went to the emergency room, and luckily there I hemorrhaged, and more or less I had an emergency C-section due to the hemorrhaging. Without Heaven's Loft being here, I don't believe I'd be as good a parent as I am, because it's encouraging.
Me ayudaron en que siempre me checaban la presión.
She had a kidney that stopped functioning before she got pregnant, and she was very worried about getting pregnant. So when she did get pregnant, it was very important for her to come to Heaven's Loft to be checked every week or every 2 weeks to see if there are any symptoms that would send her to the doctor.
I went through a lot with my pregnancy with him. I was on bed rest really early, so when I came here, it was basically coming here like a doctor's appointment every week. It was some stuff that I had found out here that my OBGYN didn't, let me know. And, it was one Christmas that I didn't have enough to give to my children, and they went above and beyond. I love them.
Baptist Health is helping people manage and improve their own health, and sometimes it's their only access to health care.
I was on my own. All the information I learned about diabetes was on television, radio, and I got a letter from these wonderful people one day, and they asked would I be interested, and I got on it. One of the best programs for individuals who have diabetes.
In addition to providing all the necessary equipment to manage his diabetes, Baptist Health Community Outreach discovered that James was seriously ill and in the emergency department because he couldn't afford his medication.
God bless her. She took care of me, and she was able to help me get my medicine, and I've been on track ever since. Wasn't for them, I wouldn't be right here, right now as we speak.
Before I learned about Sister to Sister, I did not make a concerted effort to exercise, to walk, or do anything. I'd get up and I have my lethargic routine, and I was overweight, and I've been dealing with diabetes for about 30 years now. Once I started the program, my blood pressure went down, my cholesterol went down, my blood sugar was under 100, and I lost 16 pounds during the 16-week session. I feel great. This has been a real good thing for me.
Through community wellness centers, Baptist Health Community Outreach is providing services to the uninsured, underserved, and to those with limited access to health care. And in Violet Bagley's case, it meant discovering a serious heart condition.
They came here and was taking blood pressure, and since I had blood pressure problems, I just came and started having mine done. Then they encouraged me maybe I should see a cardiologist. He immediately said I had to have a pacemaker, and I did not know that I had anything connected with my heart. I thought it was all my blood pressure. It's such a wonderful service to the center here and to the people. They're just wonderful, and please don't take them away from us.
These nurses can catch something that's, real serious before it gets out of hand too, save someone's life. I was homeless. I was sleeping over in the freight yards in North Little Rock, coming down through the Riverfront Park area by the Broadway Bridge. I was standing there watching a barge go by. I thought, a big boat, it was a huge one coming up the river. I was kind of watching it, and as it passed, I went to turn, and the entire bank under my feet just dropped, caved in with me. And I fell about a good 10, 12 feet down, and it was a good 20 feet to the water I grabbed a bunch of roots and stuff and hang on, and then the bank itself came down again on top of my head. I had gashed me open real good. I didn't realize I was cut at the time until I got here, and they said there was blood all over me. They scrubbed me down real good and put the betadine on it, and the antibiotic ointment, and Vaseline, and then they gave me some to take with me to keep it clean. I love this place. These ladies do some good work. They help a lot of people. I mean, some of these people, it's the only health care they get, and they care. They love these people.
Keith Wilder is disabled and has a brain tumor, and on top of that, needed help with even the basics for survival. With a partnership here at the Mosaic Church, Baptist Health is helping to meet his medical and social needs.
To know that I can come in and get my blood sugar level tested, my heart rate, I'm thankful for that, because those are two major things that plays a major part in my health situation. Not one time that I've ever asked them how was my rating or what was, was it good or bad. They didn't just give me it's okay and let me go answer. They took their time out to help me with knowledge of what it is I needed to do.
In addition to helping him manage his own health, they also helped him find health insurance after numerous unsuccessful attempts to do so on his own.
I've had no kind of health care coverage, and I have a host of health care problems. And after I got turned down all those times, to know that I finally tried one that was referred by her and I was approved and accepted, it released a very heavy burden on my heart, mind, and soul. Thank you.
Thank you.
Thank you.
Gracias.
Thank you, thank you, thank you.
Thank you.
Thank you.
Thank you.